Hi, everyone. Thank you for joining today's live Q&A with WHO expert. I'm your host, Sari Satyogi from WHO Department of Communication. And with me today is our unit head for Food and Nutrition Action in Health Systems, who is also our breastfeeding and nutrition expert, Lawrence Grummer-Strawn, who we all call Larry. Hi, Larry.
Hi, good afternoon. How are you?
Good. How are you doing?
Doing great.
So we're connecting today from our homes. We're still working from home. And as some of you might know, this week is World Breastfeeding Week. It's important to support breastfeeding moms, not only this week actually, but throughout the year. And in previous breastfeeding moms, actually, not only this, we live Q&A, we actually received some comments that our breastfeeding expert is actually a man. Yes, and we are actually very proud about that, because when it comes to breastfeeding, it's not only the mother's role, but also the partner, family members, friends, everyone plays a role in supporting breastfeeding to be successful. Right, Larry?
Absolutely. And that's been the story of my career, is always working in a field that's kind of dominated by women. And clearly the practice is one that's carried out really only by women. But as a man, I'm really here to call for that broader societal support for breastfeeding, and what are the things that we can do in our health systems and the actions that we do as a society, the support at work. I'm really trying to push for that kind of support for women.
Great. Thank you, Larry. And for you who are joining us today, feel free to ask your questions around breastfeeding and also on breastfeeding and COVID-19. Post your comment on Facebook, or if you are on Twitter, then ask your question, use hashtag AskWHO. So we're talking about COVID-19, Larry, because aside from the breastfeeding week, it's actually the top questions we have been getting across our social media is about breastfeeding in time of COVID-19 pandemic. I think we understood that mothers, parents, especially new parents, are worried about their chance to breastfeed during this pandemic. So perhaps we can start with that, Larry. Is it actually safe to breastfeed when you are suspected or confirmed with COVID-19?
So WHO is very clear in its recommendations that we do recommend continued breastfeeding for all mothers, whether they are COVID positive or not. Even if a mother is infected, she can still breastfeed her baby. She should still hold her baby close to her, have that skin-to-skin, close contact with her baby. And the reason for that is that we've looked at the balance between the risks and the potential harms from COVID transmission. The risk of transmission seems to be extremely low. We've not documented anywhere in the world any clear cases where the baby did get infected from COVID. It doesn't seem to be infective in breast milk. Very seldom has it been found in breast milk. And yet for the consequences of not breastfeeding, we have well-documented consequences. So if that baby is deprived of breastfeeding because the mother is trying to prevent COVID transmission, she's likely to be putting her baby at risk of so many other kinds of serious outcomes. Globally, we think there are about 820,000 children who die each year just because they weren't breastfed, because they're not getting that support of their immune system. They're not protected against diarrhea, respiratory infections, long-term consequences like obesity, protection against sudden infant death syndrome. There's just such a long list of the benefits of breastfeeding that would be foregone just for that kind of protection against a potential transmission that seems to be extremely rare. And even in those babies that have gotten it through other means, they've had very mild cases. And so we think that we will be preventing something very mild in exchange for losing something very important. So that we really do breastfeed. We do recommend breastfeeding continue.
Great. Thank you, Larry. And thank you, Melissa, who asked that question on LinkedIn. And actually, I can share my experience. I'm also a breastfeeding mom, and I had COVID-19 myself back in March, and I actually continued breastfeeding my son. I use mask to cover my cough, and I clean my hands frequently. And my son actually was not infected with COVID. So yeah, I mean, I can vouch for that breastfeeding during COVID is actually okay.
It's always good to hear those personal stories like that. I think it's important that I do also comment that we think that we know that the SARS-CoV virus is primarily transmitted through respiratory drops, and so the primary thing that the mothers need to be doing is wearing a mask to protect their babies and washing their hands frequently. So that same advice that we give in general to prevent transmission would apply to that breastfeeding mother.
Right. Yeah, thanks for clarifying that, Larry. And in case mask is not available for moms who are suspected or confirmed with COVID-19, what can they do?
Well, WHO has put out advice about how to make cloth masks using various kinds of cloth that might be available. And so even if you can't get access to a medical mask, use of some other kind of homemade mask is probably a good second option. But even if a mask just can't be made available, if the mom just can't get that, this is not available in the community in any way, it doesn't change our recommendation for breastfeeding. We still say that breastfeeding is more important because that risk of transmission still seems to be quite low to the children, and the consequences seem to be quite minor in them compared to the very significant consequences of not breastfeeding.
Thanks, Larry. Question from Ahmed, also from LinkedIn. What precaution moms can take to protect newborn babies generally and while traveling during this COVID-19?
So certainly they should be taking the same precautions that we would recommend in general, of wearing masks and washing hands frequently anytime that she's been touching substances that have been touched by other people. That there might have been some breathing on them, so she should be washing her hands quite frequently. Anything that she's dealing with that would be touching the child as well, she should be washing quite frequently. So the same kinds of protections that we would expect in general to stop the transmission of the virus would be quite appropriate for dealing with a young child. A mother who is COVID positive should really be wearing a mask at any time that she's caring for her baby.
Thanks, Larry. For breastfeeding in general, even when COVID is not around, some new moms especially, they often need support, encouragement. How is the support system during COVID-19?
So we're very concerned that there are a number of things happening because of the pandemic that are limiting mothers' access to good lactation support and breastfeeding counseling services. Oftentimes, the clinics that she might be going to for her normal prenatal care support, the checkups that she might be doing with her baby afterward, the clinicians that would be providing that support sometimes have been moved over to COVID response. And so they're taking care of patients in other parts of the healthcare system. Maybe they're working in the intensive care unit to take care of patients, and so they may not be available. Some mothers feel uncomfortable going to their normal maternal and child care visits because they're afraid that there are other sick people around, and they don't want to expose themselves or their babies to those. Oftentimes, the breastfeeding counseling happens in community settings where there are community health workers going out, or home visitors, or programs happening in communities. And because of the social distancing, people are staying away from those. And so they're not allowing people to come into their homes or come to various opportunities that they might be meeting in public. Even mother-to-mother support groups where they're getting support on how to breastfeed and answering questions about breastfeeding. People aren't coming together for that. So there are a lot of challenges to how we can provide that kind of support, but it is really important that we mitigate the impact of the pandemic on health in general, just because we're worried about the transmission of COVID. So we have to find that right balance of protecting ourselves, protecting our babies, but also continuing to provide essential services.
Mm-hmm. Yeah, I remember when gave birth to my son, and then the first few weeks, I actually get home visits from a midwife who actually supported me a lot for breastfeeding. I can ask questions. I can, when I started to feel not sure with what I'm doing, and it was reassuring to have her support. So what do we see as an alternative these days, Larry? I mean, is there like online, maybe like online consultation? I mean, are we seeing that? What are the alternatives that has?
Online consultation certainly is increasing. It existed before COVID, and we're certainly seeing it used much more. And I think we're all getting a little bit better in using the technologies of video conferencing and Zoom and multiple opportunities out there. And it is definitely a good second bet. We don't want people to become isolated, and so using those electronic means to connect with one another, to ask questions, provide information. Oftentimes the video can be used for observing how breastfeeding is going. And there are good examples where it has been proven to be quite successful. In our recommendations from WHO on breastfeeding counseling, we recommend that it should be face-to-face, but that in some circumstances, electronic means might be a good alternative. So now we're in that situation of having to test out that alternative. Studies are certainly growing, showing more and more how to do it better. We're still concerned that it may not be quite as good. Able to have someone look very closely at the circumstances that the mother is in her home, be able to observe the baby, how they're latched on at the breast, how they're sucking, and are they actually swallowing milk, hearing how the milk transfer is going. All of those are good things that you can really do much easier in person than you can do through electronic means. But I think we are getting better at it, and we really have to use whatever options that we can in the context of the pandemic.
Right. Are you aware of other alternative that has been used other than online?
I mean, if you consider phone online, we certainly have video chatting, and even just talking on the phone is another alternative. Sharing information, we're always concerned that we don't just limit ourselves to information, but information can be shared in many ways, through the internet, through paper copies, posters, so that we can teach about the importance of breastfeeding and teach how to breastfeed. And that's an important part of counseling, and we don't want to forget about that. But we also don't want to stop only with the information sharing. We also need to have that one-on-one communication to answer mothers' questions, to see how things are going, anticipate any problems that might be coming up in the future.
Right. Well, let's all hope that the situation will get better soon, and home visit can happen, and counseling can happen again. We started getting some questions from social media. For those who just joined, today we're talking about breastfeeding in time of World Breastfeeding Week, which is this week. And also we talk about breastfeeding during COVID-19 pandemic. Question from LinkedIn: is there any evidence that COVID-19 might be transmitted through breast milk? We talked about this earlier, Larry. Maybe you can repeat again.
Just to summarize, so far we have not seen any evidence that the virus can be transmitted through breastfeeding. That doesn't rule out the possibility that we couldn't find it ever in the future. We are still learning a lot about this virus. But in general, when we have tested milk samples from the mother, the vast majority of those have been negative for having the virus among mothers who are COVID positive themselves. But it's not 100%. There are a few milk samples that have actually found the virus. But the tests that were done on that virus indicated that it really was just fragments of the virus. Perhaps it had been killed previously or inactivated, because in the tests that they did, they were not able to replicate that virus. It was not really infectious. Like I say, it's possible in the future we will find some samples where it is possible, but we think that the risk will be extremely small.
We received also two questions, actually, are quite similar. One is from Facebook from Plans Victor Raul Puababana. I hope I pronounced it correctly. And the second one is from LinkedIn, from Yomi. Thank you for your questions. So, Larry, they're basically asking about breastfeeding that is already a challenge in rural communities, and especially communities with some high poverty level, with inadequate knowledge about the pandemic. What can be done for this community?
I missed we just broke up very briefly at the very beginning of the question. So that in the rural communities, the breastfeeding rates were lower than in urban areas?
No, they're not saying lower, but what kind of support that can be given to this community where it's in a rural community that normally already, even without pandemic, it's already a challenge to monitor the breastfeeding. So what can be done for these communities, considering their poverty level and also inadequate knowledge about the pandemic itself, how to continue observe and encourage breastfeeding in this community during the pandemic?
So around the world, what determines who is able to breastfeed and who has good knowledge about breastfeeding is not so clear that a low income versus a high income, or rural versus urban populations. In fact, rural populations tend to have higher rates of breastfeeding around much of the world, and low income people often are more comfortable with breastfeeding than high income. That doesn't mean that we don't need to still provide good services in rural areas and in low income communities. We most definitely do. But we shouldn't be assuming that just because they are low income, they're less educated about breastfeeding. How do we reach them? It certainly depends on the nature of those rural communities. Oftentimes, rural communities still have gatherings of people that are close enough by that home visiting is still possible. They still can come to clinics, that there are clinics out there that are serving their needs in other ways. And so it certainly is not that we would say that they're just disconnected entirely. In very, very rural areas where there's widespread distances, it can become more challenging. And the electronic means that we were talking about earlier are sometimes ways that we can reach those women with the kind of support that they might need, because they are very, very far flung from someone who can provide them the kind of support. What we often also find is that in those communities, there are good networks of family members who have experience with breastfeeding. And so we shouldn't always depend on, it has to be a healthcare professional who's gotten professional training. We do think that that's important, and we should increase access to that around the world. But certainly in communities where they just don't have much access to healthcare, we shouldn't be ignoring the fact that families are also important.
That's right. Interesting what you said earlier, Larry, about breastfeeding in high-income country versus in low-income country. What are the different challenges? Why sometimes in high-income countries we actually see lower breastfeeding rate?
So there are a number of reasons. One is the availability of infant formula. Formula has been marketed and promoted quite extensively in high-income countries for a very long time. The affordability of being able to purchase that formula can sometimes make it a lot more accessible in high-income countries, and so it becomes more of the social norm that it's an easy way to feed your baby. If you just get a bottle and just feed, and you don't have to be around the baby. And the industry has really taken up an approach of kind of capitalizing on those needs to push their products, and they've done it for a very long time in high-income countries. There are also issues of going back to work. Oftentimes, employment is outside the home, and therefore it makes it more difficult for breastfeeding to happen. In many high-income countries, they don't have adequate protections of women, so they're forced to go back to work much earlier than would be in our recommendations, and that makes it very difficult to continue breastfeeding. And so they just feel that, well, they have to turn to another alternative. From our standpoint, we would argue we need to fix those systems. We need to change the laws around paid maternity leave so that women are protected from having to go back to work so soon. We need to have protections at the workplace so that she can continue breastfeeding, even if she is working at the workplace. I do think that we're probably learning a lot, excuse me, we're learning a lot because of this pandemic about how people can work from home, how to communicate and do their work in other ways that in the long run potentially actually could be beneficial to breastfeeding and supporting them to be able to stay with their babies while they continue to work. But we're still working through many of those.
Interesting. Yes, some colleagues in the Department of Communication actually became new mom recently. And some of them actually said that the support that they're getting these days during the first few months is great, but they're also worried about the support that they're getting or consultancy that they're getting once they return to work. What kind of support? Because it's for them, it's a different game, so to speak, when you need to use the breast pump and all that, like how to keep going. What kind of support that breastfeeding working mom could get, Larry?
So first, just building on what you were just talking about, the need for people to provide that support. It's important that we remember that women need to continue getting support throughout the first 2 years of their baby's lives. WHO recommends that breastfeeding should go for at least 24 months, and even beyond that if the mother and baby are both happy with it and want to continue. So we need to continue to provide that support. Oftentimes healthcare systems are just set up to support the mom in the first 6 weeks, and then, okay, she's fine with her breastfeeding and she can go off on her own. But there continue to be challenges with maintaining a milk supply, new issues of feeding the baby, and new issues with having to go back to work and changing family situations. So that continued support with additional breastfeeding counseling support, asking questions of healthcare providers, working with community health workers, mother-to-mother support groups, are all ways to address some of those challenges that continue to arise throughout the first 2 years of life. In addition to that direct one-on-one kind of support from skilled breastfeeding support, it's also important that we figure out ways to accommodate a mother in the situations that she's in. Oftentimes that is needing to go back to work, and so she has to figure out how she's going to care for her baby as well as get her work done. Situations of going back to school, oftentimes young mothers are still involved in education. How can they continue to be involved in their classes and continue breastfeeding? And so we need to have better legal protections for women, as well as just change the societal norms, that there's an expectation that if you have a baby, you're going to need to be taking care of that baby and providing support, including breastfeeding.
Right. Thank you, Larry. There are follow-up questions on that. You mentioned about protecting mothers. We got a question from Facebook from Amal Omer Salim, who asked, what should government do to protect breastfeeding from rampant marketing of infant formula, especially during the pandemic?
So we really have to stop the promotion of infant formula. The promotion that's happening sometimes directly where you're seeing a product, but also indirect through pulling mothers into social groups, maybe they're online groups, where the messages from the companies are coming into the conversation and changing the way she thinks about feeding her baby. Companies are taking advantage of these ways of promoting their products and dissuading mothers from breastfeeding that we all know is the healthier option. So governments need to step up and stop this kind of promotion. We need to have stronger legislation that controls the kind of promotion that can happen, the way the products can be marketed. WHO has long, since the 1980s, had policies on a code of marketing of breast milk substitutes. How do we actually stop companies from promoting their products? That doesn't mean that we want them to stop having them. We need to have formula for those babies who actually need it. So we don't want to stop access to it. So there's a right for them to be in environments that you can make formula accessible. but we don't want them to be promoting it directly to mothers or directly to the population, or to be pushing them on healthcare professionals. And therefore, we call on governments to strengthen their legislation, make sure that they're covering all of the provisions in WHO's set of rules within that code of marketing and subsequent resolutions that have refined some of the rules themselves. And that they don't just pass the legislation, but they also enforce their legislation. What we actually see in many countries is that there is legislation on the books, but we still see violations all the time. And it's because they're not actually taking action to step up with a sanction on companies and make sure that they're stopping those practices. So we're calling on countries all the time to strengthen and make sure they're enforcing the laws that they do have.
Mm-hmm. You mentioned about healthcare worker and skilled breastfeeding counseling. What role that they should play in terms of limiting this access to infant formula?
So the code of marketing of breast milk substitutes that I mentioned a moment ago has a number of provisions laid out for healthcare professionals. And in fact, WHO has created a frequently asked questions document that's available on our website for healthcare professionals on what their responsibilities are. It's not just saying industry shouldn't be doing these things, but it also says how should healthcare workers be interacting with industry. They shouldn't be accepting free gifts. They shouldn't be attending conferences that are paid for by industry. They shouldn't have their associations accepting funding from industry. They shouldn't be getting their education paid for by industry. They shouldn't accept any free gifts of either formula supplies or of even small little things, little pens and pencils or pads of paper, because those come up as constant reminders of this company and what they've given to us. And there's a literature on conflict of interest that actually shows that people, even when they've gotten very small gifts, feel a certain sense of obligation that they need to do something back for the person who has given them something. And so these gifts from industry actually change the way healthcare workers prescribe products and the way they counsel their mothers. It changes the way they talk, the way they think, and we really have to stop those kinds of practices. Healthcare workers really need to protect themselves against influence from industry.
Interesting. Thank you, Larry. It's like subliminal message in a way. Huh?
It is. It is indeed.
Mm-hmm. We're getting questions more from our followers, from Muhammad, who are asking, what if the mother with COVID actually coughing actively? Is it really okay to put on face mask and breastfeed? Maybe you can repeat again the answer.
So we still recommend breastfeeding because of the importance of breastfeeding. And as I said, there really hasn't been documented transmission of the virus. We do recommend that she should be wearing a mask to hold all of that coughing in. She's not getting the respiratory drops all over the baby. And we would recommend that she's coughing into a sleeve, turning away from the baby in addition, and that she's washing and cleaning everything that she might have come in contact with. So if she's getting it on her hands or she's getting it on her elbow, that those surfaces also get cleaned, because we know it's through those respiratory drops. It's those fluids that are passing the virus on to a baby. And so as long as she's protecting herself or protecting her baby through those standard precautionary measures, we think it's important that she still stay with her baby and still breastfeed.
Thanks, Larry. One thing that came to mind, you mentioned about skilled breastfeeding counselor. What kind of training that they actually get, and what kind of special skill actually that they can offer to mothers?
Yeah. So unfortunately, they don't get enough training. Around the world, we see the problem that there's inadequate training on breastfeeding support. It really needs to start in what we call pre-service training. So before they're actually functioning as a healthcare provider, when they're in medical school, or nursing school, or midwifery, wherever they're getting their education about how to provide healthcare, We need to make sure that breastfeeding is part of the education that they're getting. That includes how to counsel mothers on breastfeeding, as well as how to deal with the physiology and whatever problems might occur from breastfeeding. And so it needs to be built in from the start. We also would argue that we can't just wait for a new cadre of people with a new curriculum to come into working. We also need to be educating the existing healthcare workers. And so that means we need to have training courses, we need to have continuing education for them. There's always emerging science and emerging issues for them to stay up to speed with how to provide this kind of care. Unfortunately, what we see is that oftentimes breastfeeding education is the last thing that's prioritized. And so healthcare providers will jump on a course to learn about a new medicine that's coming out, or a new vaccine, or oftentimes even about a new formula that's been made available for special purposes. And they'll take a class in that, but they don't take the class in standard breastfeeding support. So we really need to change that. Tomorrow, WHO will be launching a new set of training materials, some that are for the purposes of testing that healthcare providers have received the skills that they need. And so it includes a set of questions for knowledge, a set of case studies to work through. How would you deal with this situation? So looking at the skills that they're getting, observation tools where they can be observed dealing with an actual mother, and did they actually perform the kinds of services that they're supposed to perform, and checking off then that they do in fact have the competencies that they're supposed to have. We'll also be launching a new training course for hospital care of new breastfeeding mothers, and a new course about the care of preterm babies and small, low birth weight babies, and the special issues that they have for feeding. And so all of these materials will be out tomorrow for enhancing the capacity building of health workers around the world.
Thanks for sharing, Larry. That sounds very interesting. So tomorrow we'll have this training materials, and maybe you can also tell our audience, Larry, where this training will be available.
So it'll be on the WHO website. We have a particular link for all of our breastfeeding materials there. So I think if you just Google WHO breastfeeding site, and on that page there's a section for publications. So all of these will be included as new publications on that breastfeeding kind of home site within WHO.
Thanks, Larry. And you could also saw earlier on the screen our website, which is www.who.int. It's on the screen. Another question about training, Larry. Our followers from LinkedIn ask, is there a training organized by WHO for stakeholders globally on breastfeeding practices among COVID-19 positive mothers, considering the current evidence that you just mentioned, that breastfeeding is fine and recommended actually during COVID-19, because the person said that some healthcare professionals are actually not aware of this recommendation by WHO.
So we've produced a number of communication materials that are online. They're mostly oriented toward health workers. There's a scientific brief that lays out the scientific arguments for why did we come to the decision that we did. There's the guidance itself that is accessible for, that's part of the general guidance on the care for COVID patients. There's a section in there specifically for the care of patients with new babies or young babies, and it is focused within that. So any healthcare provider who is working on COVID should be looking at the WHO guidelines on patient management. There are also materials in a frequently asked question that go through the rationale and many of the questions people have asked us about this guidance, and tried to put it into somewhat simpler language for people. There's a video available from the Partnership for Maternal, Newborn, and Child Health that talks about the importance of breastfeeding among COVID patients. We have question and answer on the WHO website, answering these in very easy to understand and more generally for the public. And there's an app that WHO has created called the WHO Academy that you can download onto your website, or onto your mobile devices. And within that, there are training materials, PowerPoint presentations, and then all of these documents that I just talked about are accessible in that app. So you don't even have to be online to get access for it. Once you've downloaded the app, then you'll have access to all of this information about breastfeeding and COVID.
Great. So that's a lot of source of material already. So go to our website, www.who.int, and you can find a lot of material like what Larry just said. More questions from Facebook. What is the role WHO plays in reducing transmission of COVID-19 from breastfeeding mother to baby or vice versa? I think we talked about the precautions earlier, the clean hands frequently, wear a mask, and clean the surfaces frequently, right, Larry?
Exactly. As I've said before, the risk of transmission is already extremely low, and we want to keep it quite low by having these precautionary measures in place. WHO's role is primarily to educate the healthcare workers, healthcare systems to build appropriate policies, to work with governments to make sure that their policies are in line with good science. And so we want to make sure that the word is getting out through multiple channels, either directly from WHO or through governments. And increasingly, we are seeing that governments are coming in line with WHO's recommendations. And so we just need to do a good job of disseminating that information out to healthcare providers and to the general public. As far as the protection, it is both continuing to support breastfeeding and direct care of babies, but at the same time to use those precautionary measures of masks and frequent hand washing, not touching your face, that we talk about all the time in the protection of COVID.
Thank you, Larry. One thing that I heard actually several times here and from some people in Europe, they were saying that WHO recommendation to exclusive breastfeeding for 6 months is actually only for high-income countries, for rich countries. For the low-income countries. Is that what do you think about that?
That's clearly not the case. WHO was very clear in putting its recommendations together, that they are applicable globally. They're not just for low-income settings. We know that breastfeeding continues to provide the nutritional needs of a baby throughout the first 6 months of life, and that any introduction of other either solid foods, semi-solid foods, or a formula will dampen those benefits of breastfeeding. When a baby is old enough that they need to have additional foods for nutritional reasons, of course, we need to protect the nutrition of the baby, and that's why we do transition into a mixed diet and then ultimately into eating all family foods. But for those first 6 months, the recommendation is absolutely applicable in high-income settings as well. And increasingly, we're seeing high-income countries are coming around to that recommendation and seeing the merits of it for their own populations.
Mm-hmm. Mm-hmm. Thank you, Larry. And with that, it's actually the last questions from our audience. Thank you so much for everyone. I have a long list of countries who join us. Some of them, Côte d'Ivoire, Pakistan, Nepal, Switzerland, Senegal, Sweden, Brazil, Colombia, Japan, Saudi Arabia, Indonesia, Mozambique, Algeria, Australia, the Philippines, Kenya, Nigeria, and many more. Thanks to you as well, Larry, for joining us today. Thanks so much for your time and sharing your knowledge. Let's hope that the situation will be better for all of us, and that will be better for breastfeeding moms as well. throughout the week, we will continue posting materials on World Breastfeeding Week across our social media channels. So go visit us there. And if you're looking for information on breastfeeding during COVID-19, please go to our website, www.who.int. I am your host, Sari Satyogi. Thank you again for joining us today, and see you soon.
Thank you, Sari. It was enjoyable to talk with you.
Thank you. Bye.